Dear colleagues, ladies and gentlemen, my name is Thomas Kessler. I'm the lead PI of mTORUS, an exciting project having the potential to revolutionize the treatment of urinary tract infections. A urinary tract infection is one of the biggest challenges that we are faced as clinicians in daily clinical practice. But not only we, also our patients in the hospital, in the daily life. Have a look into the situation how our bladder is really functioning. This is a cystoscopy, how a normal bladder is looking. The smooth bladder wall, this is the ejaculating ostium where the urine is coming out from the kidneys. In contrast, here you have this dramatically infected urinary bladder. Reddish here, this will result in urgency, in frequency, in a painful burning area in your bladder, and even it may result in urinary incontinence. It will impair your quality of life. The current treatment for urinary tract infection are antibiotics. However, antibiotics often fail. Antibiotics result in resistance. And antibiotics are a harsh treatment. They not only kill the bacteria, but also destroy the normal microbial flora, the microbiome. The microbiome is a very recent story in the urinary tract, and this opens new avenues for novel therapeutic options.
The way that we have been dealing with infectious diseases for basically the past century is equivalent to if you're trying to get rid of weeds in your garden and you go out and just remove all the plants and hope that just the pretty flowers grow back. And in some cases we're obviously lucky and this works, but in many cases it doesn't. We start now to have a paradigm shift in the way that we treat infectious disease. This has started with the use of fecal microbiome transplants to treat Clostridioides difficile infections, which has been extremely successful. However, to take this paradigm shift further, we need a much deeper understanding. It's been difficult to translate this into other disease situations simply because we don't understand in many of these diseases which functions of the microbiome have been disrupted and how we can best introduce microbes to recover that function. And in order to do that, we need very deep functional data of both a healthy urinary tract microbiome and also how this becomes disrupted during acute and chronic disease processes. To achieve this, we have gathered a critical mass of world-class expertise already present in Zurich, including clinicians, microbiologists, immunologists, synthetic biologists, and bioinformaticians. The time and resources of the project have been structured to first investigate the multidimensional patient space of urinary pathologies in a large-scale longitudinal study, particularly aiming to understand the function of the urinary microbiome. We will then use this information to develop innovative push-pull strategies based on specific removal of pathogens with targeted bacteriophage and therapy of the microbiota. And we will implement this novel tool into a first proof-of-concept clinical trial. We'll now walk you through each of the main aims of mTORUS.
As we have heard previously, the bladder is a complex physiological system that is dependent on the microbiome in and around the bladder, the host immune system, and the interaction. In order to advance microbiome therapies, we need to investigate real-world situation in a large-scale longitudinal study of a large cohort of patients representing different disease states, and this is the foundation of mTORUS. We can observe the contemporary health state of patients in this study via 16S sequencing, metabolomics, and immune assays. The system's components all dynamically interact with each other, and this makes it so difficult to understand that system. In particular, we need to be able to predict what happens if one removes a pathogen, adds the probiotics, activates the immune system, or if there's no other choice, administers antibiotics. This is needed to design optimal treatment strategies to bring the patient from a problematic health state into a good one. For this, we need a systems medicine approach that involves computational models, detailed observations of the bladder system. In machine learning, we abstractly consider settings in which we have a complex system on one hand, and this is the patient's bladder, and we have an agent, and this is the treating physician, and that has a set of actions available to manipulate that system. This is called a Markov decision process. In the recent past, major progress has been made in machine learning and AI to learn optimal decision policies from observational data. Key for such approaches is to find good representations of health states and to have sufficiently many observations of their dynamics. In this project, we plan to obtain at least 10,000 observations of different time points in hundreds of patients in different health states. This allows us to compute the health state based on representation learning techniques and that can reduce the high dimensionality of the data into a low dimensional and interpretable health map of health states. For instance, we have developed a method based on self-organizing maps that uses a torus to represent the patient health state. And we can use paths on that torus to represent the dynamics of that health state. Based on these representations and using methods from reinforcement learning, we aim to predict the dynamics of the system, and this will help us to find the best treatments. Crucial for the success of such data-driven projects is an excellent data management system and also a compute environment. Here we can build on the developments in the past few years from ETH and in Switzerland in general. We can use the secure IT infrastructure called LEOMED, which is part of the Biomed IT network developed in Switzerland. We will use different tools for enabling the tracking of samples and their analyses, as well as the collection of metadata. We will work closely with clinical trial units and the data service centers at the hospital and at ETH to collect clinical data and to properly document the study. Moreover, LEOMED will provide high-performance computing and file systems that enable compute-intensive computational models.
It cannot be overstated how important it is to analyze microbiome data from patients on a very large scale as possible. So what this is good for is to get an oversight on what is there and what we need to remove and what we need to push in. This is the push-pull strategy that we're aiming to use in this large project. Many infections, including UTIs, are characterized by a high density of one or more pathogenic bacteria, shown here in red, which damage local tissues and cause pain and discomfort for patients. These pathogenic bacteria need to be removed in order to resolve injury and alleviate symptoms from an acute infection. This push strategy will be accomplished in mTORUS with engineered bacteriophages. These phages are the true natural viral enemies of bacteria and are extremely specific to the infecting pathogen, which compared to antibiotics will leave the systemic microbiome of other anatomical sites, such as the GI tract, intact. We have expertise and are well-established pipelines for genetic engineering of phages so that their natural lytic properties can be enhanced by adding effector genes into the phage genome that will be expressed into payload proteins upon phage infection and released with the host cell lysis. We currently have phages that are engineered to release protein that can target a secondary pathogen or that have enzymatic activity against biofilm structures, which are notoriously difficult to treat with SOC antibiotics. At this stage, after phage application, the bladder will be devoid of pathogenic bacteria, but the urothelium remains exposed and vulnerable and at risk for recolonization with unhealthy microorganisms. This is where mTORUS provides added value to our current phage-only strategies by delivering a highly complex microbial community of bacteria that are derived from healthy bladder biomes. Instilled UMTs will colonize the uroepithelium, thus protecting against pathogen colonization or damage to underlying tissue by pro-inflammatory molecules. The insight gleaned from data analysis of longitudinal samples will further guide in selection of appropriate timing and treatment modalities. This push-pull strategy is really what it will take to not only resolve an infection, but protect against future recurrence.
To translate this push-pull strategy to patients, we will take advantage of 3 important steps. Firstly, we will study the interaction of the components of our push-pull treatment with the human urothelial system. To this end, we will use a novel 3D organ-on-a-chip system that was developed by our collaborators at EPFL. This model will allow us to screen large numbers of our push-pull components while adhering to the 3R principles of research and thus reducing animal experiments. Secondly, we will move to preclinical models of urinary tract infection, which will enable us to investigate all relevant elements in vivo and at once, including their interplay with the immune system. This latter interaction will also determine whether our strategy is able to convert a pathogenic inflammation into a protective immunological environment. Having gained these insights, we will subsequently move to a first-in-man clinical trial in patients suffering from chronic urinary tract infections. This last and essential step will inform us about safety, tolerability, and efficacy of our push-pull therapy.
Personalized therapy really holds untold potential for patients. But personalized therapies are also notoriously difficult to test and evaluate in clinical trials. Now with mTORUS, what we focus on in the investigation and innovation phases is to create the most data-based and validated microbiome-modulation strategy possible that's really a more complete and holistic approach to treating UTIs to anything that's currently being developed. Now in this implementation phase, we really want to translate the value of mTORUS into the clinic and test its benefit to patients. So here we want to overcome 2 main limitations of personalized therapy that tend to really hold back from measuring their potential. The first one would be to develop a companion diagnostic where we could test patients at their bedside to see if they are likely to benefit from mTORUS therapeutics. And we would do this by identifying phage-sensitive bacteria directly in the urine. Now, secondly, we want to optimize our clinical trial design with a conditional crossover study. And this would allow us to measure at the patient level each patient's response to both mTORUS therapeutics and standard of care antibiotics. And this way we'll really be able to see the value at the patient level. Now, this initial proof of concept study for urinary tract infections is really going to allow us to redefine and fine-tune our microbiome modulation strategies, but it is only the beginning for mTORUS.
Now is the time to change how we treat infectious diseases. Every year, more than 150 million people worldwide will suffer from urinary tract infections, with a significant fraction suffering from recurrent and invasive disease. We are rapidly running out of treatment options. The unique skills and knowledge required to understand urinary microbiome function, to manipulate microbiota, and to combine this with cutting-edge recombinant phage therapy is here in Zurich and ready to drive this paradigm shift. mTORUS will synergize with major consortia, including Cautifage, Immunophage, and the NCCR microbiomes, with massive added value for research and medicine. It also capitalizes on existing world-leading expertise in bioinformatics and computational research, which is indispensable for this project. A unique aspect of mTORUS is the incorporation of rising star positions. These are highly promising young PIs who will each receive direct funding for a doctoral student, allowing them to establish their independence within a supportive environment of mentoring by at least 2 established professors. This builds value at every stage of investigation, innovation, and implementation by fusing diverse, fresh ideas and talent with existing expertise. It will also train the next generation of experts, providing a long-term vision.
With mTORUS, we will create a world-renowned competence center here in Zurich for microbiome modulation. And more importantly, we will provide next-generation treatments for our patients. mTORUS for Zurich and our patients.